Just some extras that you'll get in the bonus handouts. There'll be a copy of the general dietary protocol template that I use with patients. There'll also be a link to this wonderful little booklet by one of the founding doctors of functional medicine, Dr. Siebecker. He wrote this little booklet in the early 80s called Notes on the Yeast Problem. I don't think it's in print any longer, so I actually got permission from him to share that with you guys and with our patients. There'll also be a bonus video that will go over some of our favorite treatment options for SIBO and for SIFO. Candida albicans is a normal commensal organism, meaning that for the most part, it colonizes the skin and the mucous membranes for most people. And most of the time, this colonization is contained and it's tolerated by our immune system. The problem arises when things come up like taking recurrent antibiotics or other disruptions of our immune system response to Candida or disruptions of our microbiome. And that can lead to loss of this normal colonization and normal tolerance of this organism. That can then in turn cause symptoms for patients. So this is just a kind of overall view of how I view yeast and Candida related disorders. It's kind of an umbrella here at the top with overall arching yeast and Candida fungal related disorders. On the left side here, we're talking about infection. So this would be the typical well-recognized yeast-related or fungal-related infections, let's say like a toenail fungal infection or a vaginal yeast infection that are well-recognized by mainstream medicine, usually well-treated with pharmaceutical options. And then in the middle here, we're talking about SIFO, which is small intestinal fungal overgrowth. So that's not really an infection at this point. It's more of an overgrowth of the organism. And we're going to be talking about that a lot today. Finally, on the right side here, we're going to be talking about some immune-mediated issues that patients can develop in relation to yeast and Candida-related organisms. And this can actually be an allergy to the organism, which we'll talk more about, or a general immune system sensitivity or tolerance issue with the organism. And the arrows that I have here are indicating that if you do have a yeast or Candida allergy or immune-related sensitivity issue, it actually does predispose you to get recurrent infections. I suspect it also predisposes to SIFO, but we don't have research on that yet at this point. So let's say that you think you have a SIFO or yeast-related problem, and you've talked to your doctor about it, and you're wondering, what should you do now? You've done some of the available testing, and you're interested in treatment. So I came up with this diagram to kind of give an overview of how I approach this multi-pronged approach that I've developed over the last 10 or 15 years of thinking about this. We're going to talk about each of these individually, but the areas that we're going to talk about include antifungal medications or natural antifungal agents, dietary issues, nutrients, possibility of adding motility agents, as well as removing risk factors. So don't get overwhelmed. We're going to dive into these each on their own and talk about them in detail here. Let's start with antifungal medications. So here we go. So, I always take into account risks and benefits of using pharmaceuticals versus natural agents, and I like to give patients the options of both. So, of course, you'd be using pharmaceuticals under the guidance of a physician, but the main ones that have been used include fluconazole, which is a systemic antifungal medication. And with this one, you just want to keep in mind that it can affect liver function tests. Clinically, we rarely see that as long as we're checking a baseline function and then you're monitoring that every so often if you're on this medication, but it's actually been shown to be very safe if monitored appropriately. And then nystatin is a non-systemically absorbed medication. So this one is extremely safe. It does not affect liver function testing at all. And I'm giving some normal dosing here. It may work better if you take it away from food, just so it could get to those yeast organisms in the gut. But if it causes any irritation, it's totally fine to take it with food as well. I wanted to mention this article, this online publication available called the Antifungal Parade. So this was something that Dr. Siebecker, again, one of our pioneering doctors in functional medicine, published several years ago. He found that treating a lot of his adult patients with chronic complex illness, as well as treating autistic patients with antifungals, proved to be really beneficial. And he goes through this sort of parade of options that you can use with antifungals rotating them every couple weeks to see which ones the patient may respond the best to. So feel free to take a look at that if you're interested.